Welcome to another episode of Wild and Well. Today we are talking all about primitive reflexes, what these are, and why they're so important for our children's brain health and their development. And I'm talking to Jenn Evans, who is a pediatric physiotherapist. So welcome, Jenn. Thank you so much for coming here and being on the podcast. But before we get into it, can you tell us one thing that you did today to take care of you or nourish yourself?
Oh, I love that question. I would say my one thing today was cracking open a fresh bottle of Coffee Mate in the morning. There was a little crisis. I thought I was out, and I went into the backup fridge, and there it was. And you know what? That really made my day, where I was like, you know what? It's gonna be a great day. We have caffeine. It's gonna be sweet caffeine. Now we can go do the things. And when your day is filled with trampolining and then some traditional physio and then a podcast and then back onto the trampoline, that sweet caffeine was the needed start. So it was one of those moments where I was like, you know what, is this going to make or break my day? And it made my day. So we are good to go.
Amazing. So, can you share a little bit about yourself and what it is that you do?
Yes, absolutely. So I am a pediatric physiotherapist. I always knew I wanted to be in physiotherapy, and I was very much guided by my parents who have a background in healthcare. My dad's a physio, my mom's an occupational therapist. So always knew that I had kind of that passion for healthcare, but I was also that, 10-year-old child with any baby infant on my hip. Whoever I could steal and grab, I had that. So I kind of knew quite quickly that to combine my passions, I needed that healthcare side with that pediatric side. And the more exposure I got to children with various disabilities and conditions, the more that really lit my fire. And I found my passion within that world. So I specialize now in neurodevelopmental physiotherapy. In the city where I work primarily, I have a huge, really complex caseload, a lot of, the most rare of the rare, the one in a million conditions, the kiddos that shouldn't be here and yet are. So I'm really, really lucky to work with, kids that inspire me day in, day out. And then with that practice, I've been able to expand it a little bit out of the city and up north towards you, where I'm now once a month doing some consultations and working out of the Well Body Group, which has been such a great experience and allowing me to pull a lot of my skill set from these really complex bodies that I've worked with for 5 years now, and tailoring that to the more kind of typical developing body that still has complex needs that need to be kind of unpacked and discovered in, a healthcare system that doesn't have great access when you're a little bit more rural and remote. And these kiddos aren't necessarily being picked up for things like autism, ADHD, sensory needs, and things like that until they're deep into school age. And it's, oftentimes the teachers that are flagging it up. But then where do we go from there if there's no other pediatric professionals, specializing in these things? So I've been really lucky to really kind of get stuck in to reflex integration and the sensory side of things with this client base that I've been able to see up north. And then it's also kind of freshened that up for my clients that I see in the city as well, where while the reflexes aren't necessarily at the forefront of what we're working on, or I'll often delegate to an occupational therapist who may work on those so I can more work on the physical body. It's been fantastic having that, ability to complement my skill set and to reach out to a different group of kiddos while really feeling like I'm bringing something new to the table. And also seeing these incredibly fast results with these kids, which, is a kind of a different spectrum for me with my client base in the city is very complex, and we are celebrating every inch stone, but the inch stones can be very small and very spread out and kind of few and far between. So the gains take quite a while to see versus with the population I've been working with at the Well Body Group, specifically with reflex integration. I've been seeing the changes so quickly because oftentimes it was just this little missing piece that they needed to then, find their ability to regulate or, finish off that last little bit of potty training and these sort of little bits. So it's been really cool to seeing, the inch stones happening, but then also these bigger milestones happening quite quickly in front of me where I'm like, there's definitely something to this reflex integration pieces. And the number of parents that I'm talking to who don't know anything about it, has never heard even the phrases of primitive reflexes or reflex integrations. So this podcast is fantastic in kind of giving me the ability to share with families who maybe have heard about these things but don't even know where to start, because the deep internet is, so deep and dark, and you can go down the rabbit holes really fast. Or it's just so novel that it's, not even mentioned until there's an issue. So thank you again for this opportunity, but I'm so excited to share, all about these weird and wonderful primitive reflexes and kind of what my scope is as a physiotherapist and what I can do to support families and kids.
Yeah, I so appreciate the work that you do. And it's true that not very many people are aware of primitive reflexes, even though this is something that we all uh, go through, right? It's like I don't know if you call it a milestone, but we have these reflexes when we're young and we integrate them. But it's interesting that as adults, we don't actually know about them. And so many, even people in the health space aren't very aware of them either. So it's really great that you are working on this and bringing this knowledge to us because it impacts so much, doesn't it?
So much. And as we get into it, like our sensory system and our reflexes are so tied in with our nervous system and our ability to regulate and our ability to participate in life. And if that system is essentially on fire, how are we expecting kiddos to sit still in school? How are we expecting this level of success from them when their system is just so dysregulated? But even we as the adults, we often don't have the words to describe what we're feeling. Often we have a bigger toolkit than those kids where we can manage a lot of these things. But how do I expect, a 5-year-old to say to me, like, I can't physically sit still in class because I'm getting this noxious input up my spine whenever my back touches the back of the seat. So I can't touch the back of the seat. So I'm always wiggling and fidgeting. They don't have the vocabulary or the insight to share that with us. So instead, we hear from the teacher, little Johnny doesn't sit still. Little Johnny's not paying attention in class. And they quickly get sent off, especially little boys, for an ADHD diagnosis, when potentially it was as simple as there's a reflex that's hung around. Why it's hung around, we need to look into. But if we can integrate that quickly, now we've got a completely different presentation. And did that child ever need to go off for that ADHD diagnosis? Or better yet, do they ever need to be medicated? Right? So there's all of these pieces, and a lot of the research is showing now the link between primitive reflexes and children with ADHD and autism. And there's so much overlap. But for me, clinically, that makes me think, is there so much overlap, or is one contributing to the other? Or if we can manage the primitive reflexes and integrate them, would they still meet the criteria for ADHD? Would they still meet the criteria for autism? Or was it purely coming down to those retained reflexes? So yes, the research shows that there's so much overlap, but I'm almost like, is it a chicken or the egg thing? And I don't doubt, I absolutely see children with ASD, with ADHD, who also have primitive reflexes. And I know that even if we manage those, we would still be dealing with neurodiversity. But I can also manage some of these reflexes and help them to manage their regulation and their sensory profiles and all of these pieces. And then we have a better sense of where we can support them with their neurodiversity as well. So I don't want this to say like, hey, if we sort everyone's reflexes, we're never going to have ADHD or ASD hanging around. Not the case, but I also think that there's definitely underpinning therapies that can be so beneficial for that client base, and maybe even should be at the forefront before diagnosis to see, kind of what's there. What can we work on? As many treatments are out there that claim to quote unquote cure autism, we're not curing a neurotype. That is a different neurotype. But if I can help them with their sensory needs, with their self-regulation, now we've got a body that's much more comfortable in space. We've got an individual that's much more comfortable in their body. We're going to see a change in behaviors. We're going to see a change in communication. So there's, I think there needs to be more emphasis on that kind of at the forefront. And so it comes down to us as professionals to seek out this training. It's not taught to us in physio school. It's not taught to us in OT. It's us going out and doing that continued professional development and learning about these things that are still pretty new within this world. I mean, we've always known about primitive reflexes. That's how, and we'll get into that a bit more, but that's how our babies survived. Even back in the caveman days, the reflexes are there so that babies can come out into this world and they can find a food source. That suckle reflex is innate. That rooting reflex is innate. They know that when there's input on their cheek to turn towards that input because it's likely a food source, right? But eventually that needs to disappear because that's not going to be functional forever. We can't just suck on anything that gets put in our mouth. That's not functional. We can't just go towards and open our mouth anything that touches our face. Not functional. But when we're in infancy, we need those pieces. So we've always known about these things because we've always seen them. We all know it's cute when a baby holds onto her hand and doesn't let go. Hate to ruin that for you. It's a reflex. They're not choosing to do that. Sorry. But we've always known that. And only now are we like, oh, but what happens if they don't integrate on their usual schedule and pattern? And only now are we starting to see there's things we can do about this. There's things we can identify. There's tools that we can use to help to integrate these reflexes. And then now we're starting to see more research come and support that. But it's funny that, again, I mean, in all kind of therapy worlds, things need to be around for ages before they're A, researched, B, put into practice. And especially when it comes to pediatrics, there's not a ton of funding to research that sort of stuff. So it doesn't happen. But I've been very lucky to kind of find on my own and through working with some really fantastic occupational therapists that have a huge focus in the sensory system and in primitive reflexes who've guided me towards a course that's run by the Sensory Project that has really given me the foundational understanding that I have of primitive reflexes. And I can send you, I think you have the link, but to add it to the podcast kind of show notes as well for anyone that's interested in the course. But it was a great kind of foundation for me. But my biggest learning has been putting that into practice and seeing what that looks like in my client base and in my complex kiddos, in my, physically typical kiddos, and that kind of that wide spectrum, because our kids are really sneaky. They learn ways of managing movements around their reflexes despite them not fully being aware of them. So even, I'll have the highest level of athletes come in and I'm like, oh, actually, you can't look fully to your right side without your entire left side bending. So what do? You never actually fully look to your right side because it causes that. So these kiddos generally, if they are neurotypical, will find ways around these movement patterns and just kind of manage, which is why it's been really cool, like finding all of these little reflexes and being like, hey, actually, they're probably working really hard to be able to do any ball sport right now because of XYZ. If we can help to retain or integrate that reflex, we're going to see a change in gym class. We're going to see a change in their confidence on the field, where right now it's eliciting a lot of anxiety for them because they're having to do all of these compensatory movements. So yeah, it's been a really good learning curve for me, and I continue to learn as I teach parents about it and as I work with kiddos and work towards integrating them and identifying these reflexes. And we'll forever be learning about it, and the research will forever be coming, hopefully. But even if I test 12 kids, give home programs to 12 kids, and one of those home programs makes a difference, I'm like, that still made a difference for that kid. That still made a big difference for that kiddo. So yeah, it's been really neat.
So, can you tell us a bit about what exactly primitive reflexes are and what this integration of them is?
Absolutely. So, as I briefly mentioned, primitive reflexes are automatic and involuntary movements that are present in infancy. So, they develop in utero and are present in infancy as well, and then integrate with typical movement patterns. So, the idea is that these reflexes are there again so that that baby can find a food source, so that that baby can start to roll, so that they can start to lift their head up when they're on their tummy, but that gets replaced by muscle strength that then kicks in so that they've got endurance to hold those positions rather it just being a reflex that puts them there. They then build the skills to get in and out of those positions. So it's not just reflex led, where once I'm in this position, I'm stuck. I can use it functionally and I can come in and out of it. And through typical newborn movements, as we see, if you're a mom, your newborn is never still. If they're awake, the arms are moving, the legs are moving, the head is moving, they're always wiggling. And just that movement helps them to break down these reflexes and replace them with conscious movement patterns. What generally happens is, and there's a lot of different kind of risk factors for having reflexes that are retained, but an example is, in kind of the more severe end of the spectrum, is if a child has a birth trauma or an injury to their brain at birth. So would likely then end up with a diagnosis of cerebral palsy. They will either have some level of spasticity in their muscles, a change in their muscle tone. That's going to affect their ability just to do those typical newborn movements. That typical kind of kicking of the legs, moving of the head side to side, moving of the arms, wiggling around, exploring their environment. If they're limited right away by their tone or things like that, they don't get to do those typical movements. Those reflexes don't get replaced by those conscious movement patterns, and they become really ingrained. And then we've got a kiddo who, for example, the asymmetric tonic neck reflex, when we rotate our head all the way to the side, in babies, you'll see them go into this fencer's position, we call it. So the direction that they're looking, that arm extends, the other one flexes up. That's functional for babies because if they're looking a direction, they're likely wanting to reach that direction. Fantastic. It facilitates that for infants. Not functional, however, if every time you look a direction, you're extending one half of your body and flexing the other. Also, when I come down to self-feeding, if I'm looking at the food that's in my extended arm, how am I getting that arm back to my face when my reflex has me fully locked out with that arm? So it really comes in and is very obvious in our complex bodies where like they are so stuck in that ATNR position, they need to bring their head back to midline to even unlock that arm and come back to neutral. So it's very obvious in some kiddos where you're like, whoa, your head really dictates exactly what happens to your body. I've got clients who, as soon as they lose their head control, that chin tuck happens, everything goes into flexion and they're on the floor. So they might have just been in standing, something might have caught their gaze, brought their eyes down, all of them are down. That's not a conscious choice. That's a reflex kicking in and pulling them down. So with kind of typically developing babies, as they go through their milestones, these reflexes start to integrate with typical movement. So a lot of them, for example, like our Moro reflex, our startle reflex, that's a survival reflex for babies. That's to the point that if there's a loud sound, a fast movement, something that startles them, they wake up and cry to alert their caregiver that something has happened. Now, if you're a new mom who's trying to get your baby to sleep, the Moro reflex is your least favorite reflex. And I'm sure you're yelling at your partner, don't make any sounds. They're going to startle, they're going to wake up. But we do need that reflex initially, and then you'll gradually see your child, yes, go into a startle, but not fully wake up. And then they'll do a little bit of a startle, but they're still in sleep. And that's it slowly integrating to the point that it's not causing that full alertness every time. Specifically with the Moro, things that can affect its integration. So with our Moro reflex, arms go up into extension overhead, head usually flies back, like that really surprised thing or kind of position that we would see. If you surprise someone, what are they going to do? Arms go up, head goes back, type thing. What we'll often do with babies to help them sleep is we swaddle them. Everything is tucked into flexion. But if we don't let them go through the full movement of the Moro reflex and come back out of it, we're inhibiting its ability to integrate. So while you might be getting a better sleep out of your baby because they're not being woken up by their Moro, they're also not having the ability to work through that Moro and integrate it. It is one of the reflexes that in typically developing babies, it's a learned pattern. Oh, that's a startle, but nothing bad has happened to me. I can relax and go back to sleep. And it's that learning pattern of, oh, my body's woken me up, but I'm okay. I can then absorb this input and go back. And that's what helps to integrate specifically that reflex. But again, we need these reflexes. Our spinal galant reflex, that one happens with input that goes down the spine, either sides of the spine, causes flexion. That one, the only reason that they've really found for it in research is it helps the baby get out of the birth canal. With every contraction that causes input on that child's spine, they are wriggling their way out of the birth canal. It's helping them to get them out. We often see that one retained in kiddos who are born with C-section because they didn't get to use that reflex functionally and go through that pattern to help to integrate it. And so with our spinal galant reflex, we often will see that present in kiddos who have gone through potty training successfully or with some issues, but have gotten to a place where they're dry during the day, but are consistently having accidents overnight, where that back hypersensitivity has remained. And input on one side of the spine causes side flexion, input on the other side causes side flexion, input on both sides causes full flexion, and it activates the bladder to relax. That's why we get kiddos wetting the bed. Kiddos don't stay in one spot when they sleep. They're wriggling all over the place. If they're sleeping on their back and they get that input down both sides, their bladder is going to release. It's not going to be a matter of limiting their water before bed. It's not going to be a matter of waking them up, 3 times a night. You can't control the wriggles that are happening in between, and they will have that bladder release. And that's one of the cases where I've found such a fast benefit in working through exercises that help to integrate the spinal collant reflex. I've had a kiddo come in, tell me that they will wear pull-ups at night. They're a little bit nervous to go to sleepovers for fear of being judged, things like this. I gave them the exercise. They came back and saw me a month later and had been dry for 3 weeks. Again, my kiddos in the city that are very complex, I don't see that fast change often. We see progress, but we don't see that quick change. But oftentimes in these typical bodies, in these neurotypical kiddos, it can be as quick as their body needs to do this movement pattern every day until we see this disappear, and we see it disappear really quite fast. And that's huge for that child's quality of life. They want to be able to go to sleepovers, not have to worry about hiding and getting dressed in the bathroom into their pajamas so that nobody sees that they're putting a pull-up on. Right? Like that's huge for that kiddo. And I've been really impressed with how many, parents I've had come in and how much the kids kind of own their stuff. And they're like, yep, I wet the bed at night. My parents, have made it a very, positive thing for me. I'm not embarrassed about it, but I don't want my friends to know. And I'm like, I think that's fair enough. I'm not here to, tell you that, well, your friends aren't good friends unless they accept you for it. No, like let's be realistic. You're friends with 8-year-old boys. 8-year-old boys can be cruel. Let's help manage this as much as we can. And seeing that turnaround, I think even for parents, we're like, whoa, because initially it does sound a little fluffy. We can't necessarily see the nervous system. We can't see these reflexes all the time. And for me to say to the parent, if your child bum scoots with their legs straight and their arms up, going cheek by cheek across the floor every day, they're not going to wet the bed anymore. Like, how does that make sense to most people, right? But then anecdotally, they do it, and I'm like, it happened. So it's been really cool kind of seeing just these little pieces. As I mentioned, like with the cerebral palsy, that's a very kind of severe end of the spectrum where there was a brain injury there. Their movement pattern is affected kind of since birth, and they're not going to get those typical movements to integrate. The other side of it is risk factors can include the child being conceived via IVF instead of natural conception has been shown to be a risk factor. Any trauma at birth, again, even leading just to a cesarean section because that baby's not going through and using those reflexes the way that they were meant to exit the birth canal. Any kind of illness or infection the mom has during pregnancy increases the risk of the child having retained reflexes. Any drug use, alcohol use, anything like that during pregnancy, again, increase risk. If you have a preemie, increase risk. So there's a bunch of these. And then towards kind of toddlerhood age, risk factors include a diagnosis of autism, a diagnosis of ADHD, various kind of sensory sensitivities. But again, those are typically related to the reflex. Even kiddos having a lip or a tongue tie, that can be linked to retained reflexes because that from infancy affects their ability to suck, swallow, breathe. So they will often have a rooting reflex still and will respond to input on their face. That's often the kiddos that don't like having their face washed, don't like having their face wiped, don't like it being touched because they don't have control and will have kind of an involuntary mouth tick. If you don't know why your body's doing something and it doesn't feel controlled by you, you're going to avoid it. Right. So I'll often have parents say like, oh, they're great in the bath. No problem. We'll tip their head back. Doesn't seem to be a vestibular thing, but I can't wipe their face. And then test them for the rooting reflex. And they've got that kind of response to input on their face where I'm like, yeah, because it's very confusing for them why every time their face is touched, their mouth is searching for a food source. That's very confusing. So they're going to avoid that. So it's been really kind of neat seeing all of these different reflexes. And there are, there's so many that we could get into and we could do a podcast about each of them, honestly. But at the base level, kind of, any complex birth history or pregnancy or any sort of delays in infancy or traditional milestone development, it's worth having that kiddo looked at for primitive reflexes. And they are easier to test the older the kiddo gets if they're able to follow. instructions and go through some complex motor patterns, it's much easier for me to test them versus having to put the kiddo in certain positions because they're either really young or cognitively need more support with following those instructions. But again, it's that kind of early intervention thing where I would rather struggle to test the reflexes in a 2-year-old than really easily test the reflexes in an 8-year-old who's now struggled for 8 years. So I will always take them early, even if it's a little bit harder for me, because if we can get to the root of it really quite early, even before they're in school, they're going to be so much more successful academically. They're going to be so much more regulated. All of these pieces will really come into play. So that's, not that I'm saying like everybody who's had a C-section, everybody who's had a complex birth needs to go have their child checked. But if you're seeing some issues with regulation, if you're seeing some issues with, they really won't wear jeans because they can't handle the sensory input on their legs. Yes, that could just be a sensory preference, but there could also be something a little bit more underlying that. So I think for parents, if they're seeing kind of anything there and being told by any professional, they'll just wait and see. They'll grow out of it. It's just how they are. It might be worth looking into these primitive reflexes because there's not enough healthcare professionals advocating for that. And it's this area that, I can really quite quickly see like, yep, this is why we're struggling with XYZ. Or no, I'm not seeing any primitive reflexes. It's not something that I can work on from a physical point of view. Maybe we go over to more the psych side of things to work through, different behavior and strategies for emotional regulation, et cetera. But if it's as easy as doing some exercises with me, why not try there as well, right? So yeah, these reflexes are huge. And I know it's a question for a little bit later, but I think it ties in really well now with kind of what can new moms do? Because as much as I'm like, oh, yeah, all of these things can be risk factors. I'm not saying that you have a C-section, your child's going to have primitive reflexes that aren't retained. Generally, it's not just one of these risk factors. It's, pulling from a couple. Yep, they were a C-section. Yep, they were, conceived via IVF. Yep, they had a tongue tie. Okay, maybe we've got enough pieces here that it's worth looking into. So the biggest issue that we've been having, the reason that we're seeing a lot more reflexes being retained in typically developing kids and neurotypical kids is everybody likes to buy the newest thing for their baby. And a lot of them are containers. So we call them container babies because it's the nicest way to phrase it. But essentially, infants that are always put in something are not going to have the opportunity to explore their motor patterns and their innate movements. They're not going to explore their ability to look all the way over their shoulder if they're always in a bassinet where I look that far and now there's the floor, so why am I going to look any further? Or if they're always in a swing. My least favorite, extra saucers, dolly jumpers, set them on fire. I don't want them. Issues being that babies are put in them well before their hips are developed enough for them to even be in weight bearing. And all of a sudden they're in weight bearing and jumping. That doesn't work for their hip development. It doesn't allow them to build their core properly. We'll often see our jolly jumper kiddos end up being W sitters who can't comfortably sit with their legs crossed because their hips didn't develop in the way that they should have, or their core didn't get the chance to develop in that seated position that we work on, that nice wide ring sit that babies, are hands down and falling out of and in and out of. In an extra saucer, they're just there and they're just up. You don't build your core in that position. So containers are the biggest thing that if I could walk into any home and eliminate, get rid of as much as you can. Always balance it with the mom's mental health. If you have 3 other kids and your kid needs to be in something for their own safety, for you to be able to put that baby down and go manage your other kids, absolutely. But let's not leave them in it for the bulk of their day. The best place for babies is on the floor. Better place on the floor in tummy time. But even if they're on the floor on the back, I will take that over them sitting in a swing, over them sitting in a bouncy chair. Just put them on the floor. It also has a huge role, and I know we're not getting into all these pieces, but visual development. If that child is never on the floor and is only in that position where they're laying down sleeping, they don't build that visual maturity that they need from being completely horizontal if they're always at an inclined position. So all of these pieces are huge. Put your babies on the floor. Just put them on the floor. And if your baby hates tummy time, there's ways around it. Tummy time can happen on top of you. Tummy time can happen on top of a wedge. Tummy time can happen with them in your arms and just making sure they're in that horizontal position. I'm not saying lay your kid on the floor for 20 minutes a day. in tummy time, even if they're screaming bloody murder. There's so many different ways to do it, but they need that input. Their brain needs it, their visual system needs it, their vestibular system needs it, their reflexes need it to integrate. So put your baby on the floor, put them in tummy time, get creative with the tummy time if they're not tolerating traditional tummy time well. And that will typically be our babies who have reflex. Babies with reflux will struggle to be on their tummy because there's already so much happening in their abdominal that pressure on their tummy isn't great. Let's bring them into our arms instead. Let's put them on top of us instead. Let's change it so that we're still giving them the benefits they need without compromising their development. So those are huge things. Other things are just playing with your baby, doing the things, but also observing your baby. Like the worst thing that I will see parents do is just hand their baby whatever toy that baby points to. No, they need to reach outside of their base of support and get that toy. If they fall, they fall. That's called learning, right? They need to cross midline. If they want a toy that's on their left side and their left hand is busy, I want to see that right hand reach over. If they're not doing that, we need to be working on that. But a lot of times parents are very good at, my kiddo goes, I know what they want. They view it as communication. Now I've given it to them. Great. Yes, you're supporting their communication, but you've not supported their gross motor or fine motor development by doing that. Babies need to explore their environment. They need to be challenged because if they're not given the opportunity to see what their bodies can do, that's when we get the babies that sit and just sit. They can't get in or out of sitting, but they can sit. And so that's how they exist in space. And then we see all of these other delays come in because we're not crossing midline. We're not transitioning in and out of side sitting or from our tummy up to our bum. So all of these pieces. So let your kiddo play. Play with them, engage with them, be at eye level, but challenge them. Put things outside of their base of support. Have that baby reach. Have them cross midline and all of these things. And it's going to be great for their development, but it also just gives you a little bit of structure to what you're doing with your baby. You know, moms on mat leave are always, the ones that I've kind of worked with are always like, I'm at home with them all day. What can I be doing beyond just like enjoying my baby? What can I be doing that's functional? This is it. You know, engage with your baby, but don't do all the things for them. If they want to get a toy that's quite far, watch them struggle. See how they're going to get there. That's the only way they're going to learn. It's the only way they're going to help to integrate these reflexes. Otherwise, that's going to be the only motor patterns that they can rely on. And again, they're functional for babies. They're not functional for kiddos who are looking to self-feed. They're not functional for kiddos who are looking to be toilet trained, not functional for kiddos who want to be sporty and do these sports. So huge. Other little bits is really just, you know, if you see anything, I hate the wait and see that our healthcare system pushes for right now. Don't wait and see. If you have the financial ability to go and seek out a private consultation, that one-off will give you either peace of mind or give you things to work on, right? And most of these babies or toddlers that I see, they don't need to be coming to see me every week. It's here's your program. Here's what you need to work on. See you in 1 to 2 months and we'll touch base. It's not a huge financial, you know, you're not committing to weekly sessions. You're not committing to, you know, say $100 a week. That's not the reality. If you have the ability to spend that money, get them checked out. And then you either get the peace of mind, we're good, they didn't see anything, or little bits that we need to work on at home. But it gives you that. And I think putting that autonomy on the parents, for those that are able to take it on, they love it. They're like, yeah, these are great games for me to play with my kid because otherwise we're playing Roblox or XYZ. Like, I'd love for my kid to be doing more gross motor games. Fantastic. So those are my big things. Babies on the floor, babies not in containers. They need the tummy time. And if you see anything as they're progressing through their milestones, as they're getting older, if they're communicating sensory difficulties to you, if they're really struggling with their self-regulation, get them assessed, either by an OT or a PT that has experience with primitive reflexes. And then kind of go from there.
And you were talking about the midline there. Why is that so important that we ensure that they learn movements that cross that midline?
Absolutely. So with our brain, our two hemispheres like to work independently, but also need to work together. So the right side of our brain controls the left side of our body and vice versa. If we are always operating as though we are two halves, where visually, whatever we kind of perceive out of our right side, we deal with our right hand and our right leg, and vice versa, we don't build those cross bridge connections between the hemispheres. And that makes big movements, thinking like jumping jacks, skipping rope, climbing a ladder, even 4-point crawling, really difficult because that's coordination of both sides of the body at the same time. So by crossing midline, we're helping to build that communication of, yes, something can be on my right side. It can even be in my right hand, but I can bring that over to my left side. And we'll often see a lot of kiddos will initially, pick up something with their right, pass it to their left in the middle, and pass it back over. Meeting in midline, that's skill number one for our babies. We want them to start bringing hands to midline and working with hands together. But then we also need them to be crossing that midline position so that that brain can develop knowing that is not just two halves, it's two halves of a whole. And that whole needs to coordinate together.
And you work a lot with people or with children with sensory processing challenges and that whole sensory system. How does that connect to primitive reflexes?
Great question. So, and it's an area that forever needs to be studied, but specifically with the spinal galant reflex, we'll often see more of a tactile sensitivity there. So, sensitivity to touch. Because if we think of the spinal galant, it causes contraction of our trunk to kind of one side or the other. So, side flexion of our trunk based off input on our back. So, that will often be our kiddos who needs the tags cut out of their clothes or cannot handle tight pants around their waist. So often we'll see that kind of tactile side with those. In terms of the rooting reflex, that's often kiddos who are reverse tactile to things touching their face because it causes that, again, reflex and them to look for that food source innately, even though consciously they're like, I shouldn't be reaching my lips towards this wipe. What is happening? In terms of the Moro reflex, if we really break that down, that is eliciting a fight or flight response in our kids. So in babies, it's waking them up. It's a survival thing. And again, through learning that and through not swaddling our babies all the time, they realize, and that kind of cognition kicks in of, I'm not in danger. Therefore, it dampens its effect to the point that it becomes integrated. If it's not integrated, we have kiddos where everything in their environment puts them into fight or flight, whether it's a loud sound, whether it's something visually crossing their field quickly. But equally, we will then have kiddos where their anxiety also then crosses into that fight or flight. So kiddos who are anxious about going to a new event, that anxiety is all of a sudden not just anxiety. They are now running away and eloping because they can't be there or have fully shut down. Right? So it all comes into play here. And the ability to really match, the size of the reaction to the size of the problem. That's the one I really see with the Moro reflexes. Everything has a big reaction. Why? Because everything puts them in fight or flight. Doesn't matter whether it's the fact of, Johnny took my sticker or the fact that I've lost my favorite iPad. Two different levels of things, likely the same response from that child because they're in fight or flight.
So do you notice that the Moro reflex is the one that is most connected to anxiety or like impacting the nervous system, or are other ones impacting on the nervous system as well?
So when I kind of go through my checklist with parents, the Moro one subjectively is going to tie in the most to self-regulation, impulse control, the ability to kind of come down out of a meltdown, what length of time that takes. Also things like the need to be in control of games or the situation, difficulty accepting change, whether that's a change in schedule, change in plan for the day, new teacher in the classroom, these sort of pieces. So a lot of that emotional side really ties into that more. And it makes a lot of sense if they are just constantly being put in fight or flight, either by the demands that are being placed by adults in their world, by the environment that they're in, or, as simple as, they always jump at the hand dryer in the bathroom. They can't cope with the hand dryer being on in the bathroom, potentially a Moro reflex, potentially because that sound puts them into that fight or flight. I must get out of there. And then it builds up that anxiety to, I know there's a dryer in that bathroom. I don't even need to hear it to already be in fight or flight about it. Right? So a lot of those pieces versus, our ATNR reflex, which is the one that where our head rotates to the side, our arms, one arm likes to extend, one arm likes to flex. That also affects our legs as well. It's more obvious in the upper limbs, but our legs are doing a similar pattern. So ball games, sports, anything that involves tracking a ball is going to be really, really difficult with that reflex Same with the STNR. So ATNR, asymmetric tonic neck reflex, STNR, symmetric tonic neck reflex. So with ATNR, we're rotating side to side, STNR, up and down. So as I was saying with some of my kiddos, we can be an extension when our head is up. Once our chin tucks, everything wants to come down. So again, think of that in terms of sports. You have a hockey player who needs to chin tuck to look at the puck. They might find it quite difficult to maintain arm extension on their stick or leg extension to propel themselves fast while skating. I'm not saying they're necessarily going to drop to the floor because they've likely managed that reflex to some extent and integrated it to some extent. However, we'll often see it at that kind of end range position where I'll have kiddos, if we're doing like a wall plank, arms on the wall, turn our head, they know if their reflex is integrated, I will often see them only turn their head as far as they know they can go without losing their arm. And then once I put my hands on them and get them that last little bit, there goes the arm bend. But they knew to not take themselves that far. If I actually had a conversation with them, would they actually consciously know that? Probably not. But subconsciously, they're like, this motor pattern works for me. I can only go that far before this happens. So I'm just not going to go that far. So it's really interesting, like seeing how kiddos manage to compensate for these things. But like, especially in school, like our spinal glenoid reflex is really strongly tied to kiddos diagnosed with ASD and ADHD. It's a lot of that, again, that tactile sensitivity. It's an inability to sit still, a lot of fidgeting. Why? Because whatever position we're putting them, if we're expecting them to sit in a chair, we're putting stimuli on their back. They don't do well with stimuli on their back. It causes movement in their body. You're not going to want your body to move outside of your control, right? Or when they get that movement, it causes side flexion. I'm going to look like I'm fidgeting all the time if everything I'm touching with my body is causing movement. So one of the big questions I get is your kiddo described as having ants in their pants? And if so, I'm looking at that spinal glenoid because chances are they don't want to be moving all the time through space. It's pretty exhausting. Something's making them do that. So it's been, really interesting just seeing these kind of all anecdotally and how these kiddos, manage to avoid kind of showing these pieces versus some that are so at the forefront where I'm like, how has nobody picked this up? With messy eaters or kiddos with food aversions often comes down to the rooting reflex. So, difficulty getting that food to mouth, knowing where that is because we're no longer getting that tactile cue on our cheek to root towards the food. It's coming at us instead. We need our vision. We need the motor planning for that. If we don't have that, often we will wait, feel the spoon on our cheek, turn towards it. They're now a messy eater when really they were doing what they needed to do to find that food to their mouth. So it's been really interesting. I think I have a bit of a rooting reflex because I really struggle with oral textures. I'm really limited in my fruits and my vegetables. In a smoothie, if I'm blending it and I know it's going to be chunk free, no problem with them. But if it's, just having a fruit, I can list a problem with every single fruit for you as to why I know I will not be able to chew that and swallow it without gagging. And I don't need that in my life. So it's really interesting. The more that I've done this, the more I'm like, okay, is that potentially a reflex for me? Is that a sensory sensitivity? Or is there a real sensory issue happening there? Well, breaking it down, does it affect my ability to, do things? Am I so limited that I can't go to a restaurant? If that was the case, I would probably seek out, some therapy to help work on my reflex. For me, it's really coming down to, it's definitely a sensory sensitivity, maybe rooted in a bit of a reflex, but at the moment, is it affecting my ability to get the nutrients I need, to engage in things that I enjoy, to go out in public? No. So I'll stay identified as a picky eater for now. But you could see that being with some kids. Some kids will be so anxious about the foods that they'll never go to dinner at a friend's house for fear of what the texture might be that their mom's going to feed. Also for fear of hurting that person's feelings by not eating that food. Comes into this big cycle. So we see that a lot with kids with autism, the kind of beige diet, the lot of processed foods, because there's consistency there. Fruit is never consistent. Even you have a thing of strawberries in front of you, every single one is going to be slightly different. You might get a sour one, you might get a sweet one. You open a bag of chips, every chip is going to crunch, every chip is going to taste the same. So it's that consistency there with the textures oftentimes for these kiddos. So it's, never have I met a kid that is picky for the sake of being picky. There's often always something there.
So when it
And
comes to eating, for example, if we use that like as an example, if we work on those reflexes that might not be fully integrated, will those issues disappear or will they still be
oftentimes,
there?
if they're simply tied to the reflex, we will often see that change. Yeah. Now, if a psychological component has been added on top of that, so even thinking about me, I know that smoothies are fine for me, but I had one bad experience at Booster Juice where a chunk came up the straw. I could no longer finish that smoothie because the chunk made me gag and put me off the smoothie. And I've not been able to order from Booster Juice since. Is that because of my sensory issue? Not necessarily. I could probably have 5 more successful smoothies from there. That's now become a cognition thing, right? Where now I'm like, now, fool me once, shame on you, fool me twice, not going to happen. But so oftentimes there will be, the correction with some of these pieces, but there may have already been that psychological, piece built on top of it. So that may be where, working with an OT that specializes in mental health or working with a psychotherapist might be beneficial to be like, okay, no, when I do the true testing for these reflexes, I'm not seeing anything anymore. What else can we unpack on the other side of things now? But on the flip side, it would be very difficult for that psychologist to unpack all of those food aversions without me managing the rooting reflex. So it often does need to kind of come in that order or collaboration wise, because, one does need to kind of sort itself out before you can really understand what's going on with the other. And that's even the case like with, the bigger scope of neurodiversity. All of these kids with ASD and ADHD, you know, can we get them through these reflex protocols first and then maybe look into some form of behavior therapy? But if the behavioral therapy is not, A, neurodiversity affirming, B, not working on sensory things, and C, not looking at any reflexes, they're fighting a whole different fight that they don't probably need to be fighting, nor does that child need to be going through that if we can prime them with their reflexes first and then send them off to these other services. So I'm not saying that by doing these exercises, all of a sudden, light switch happens, good to go. But this is often the roadblock to the next step. And then it's so much easier to break down and make strategies when it just comes to behavior or if it just comes to the psychology of things versus having something that is innately blocking them from doing the thing.
Yeah, it does seem like a really critical step that is missing for so many kids and adults alike, whether they're having eating issues or they're anxious or attention issues or behavioral issues, on and on and on. And I think it's such an integral thing for us to assess in our kids and to support them because it just can make everything that much easier.
Massively. And that's, you'll often get the older generation being like, well, my kid ate what I put on the table. And if they didn't eat what they put on the table, they didn't eat. Well, that doesn't work for a lot of these kids, right? I've got kiddos with ASD who are so averse to sensory input in terms of food that if their core safe foods aren't available, they will always choose not to eat. They also have issues with interoception. So their ability to acknowledge hunger cues, that's generally affected as well. So if we're not offering the food that is safe to them psychologically and sensory wise, they will happily not eat. And then we've got a kiddo who's listed as failure to thrive because they're not putting on weight because they're not being offered those safe foods. And, parents are really trying to get them to eat anything but it doesn't work like that. You've got to get to the root of it first. You've got to identify the sensory piece. You've got to identify the reflex piece, and then we can build off of that. I had a girlie who was diagnosed ADHD and autism. If you met her on the street, you would not know either. Masks a lot. Went to a mainstream daycare. Daycare was essentially if you sit at the table till you finish your lunch. And that puts so much pressure on her. And she also has a diagnosis of pathological demand avoidance. So again, that kind of need for autonomy and those demands being placed put her in fight or flight to the point that that child then did not eat for 4 months. She needed a feeding tube and she was in hospital for 4 months because it just built so much up onto that. But at the base of it, was it a rooting reflex that wasn't integrated that then caused a bunch of oral sensory sensitivities, which then limited her to her safe foods, but that she also felt so much external pressure to eat when others ate that demand was too high for her, put her in fight or flight. She was not given a choice to avoid that demand. It was sit here until you eat your stuff, which we'll often see. And it's not malicious, but we'll often see that first we eat, then we do other things. But for that child, it put her in hospital for 4 months because, again, the demand was too big for what she was able to do. So how was she able to get around it? I'm just not ever going to meet that demand. I'm not ever going to put myself in a position where I feel like I have to eat because that puts me in fight or flight. And the parents have worked hard over the years to build her back from that now. And we're all very careful with how we phrase anything to do with eating with her because that is her life sustenance. If all she's going to eat is Cheetos, we are going to support her eating Cheetos because we know what a fight it was to get her back to that. And then we can build from there. But there's always so many pieces. And it's not, it's never going to be that child is behavioral. That child is being picky because they want to annoy mom and not eat the food that's on the table. There might be the odd few times that happens, but if your child is consistently struggling with food, kids innately want to be good kids. Kids want to get the positive reinforcement, right? So if we can, break that down, what is the actual issue here? And not expecting our 4, 5, 6-year-old to have the vocabulary to explain that to us because they won't, right? They won't have the vocabulary to be like, when I put this in my mouth, it makes my body feel like something really scary is happening. So I can't deal with that texture. We don't. So even sometimes we don't. We spit out food all the time and don't know why we did that, right? So it's, having to view it through a different lens of almost sensory first. What's going on here? Okay, that's the texture that's an issue. Why is that texture an issue? Can we take it back? Can we look at the reflexes? Okay, if the reflexes are clear to go, maybe it is simply a sensory thing that we need to work on. Maybe we need to work on exposure to that and working through that. But how can we even do that if we've not looked at the foundational level of the reflexes?
Yeah, it makes me just think more and more that we need to address these as early as possible so we don't build on the primitive reflexes being not integrated, build on sensory issues and then like beliefs about it and just layer all that stuff that doesn't
So
need to
many
be
layers.
there. If we just start at the root of
Mhm.
integrating those reflexes, we can
Right?
set our kids up so much better.
So much better. And like a great example is here in the city, I was treating this 12-year-old elite level athlete came in for a concussion. So post concussion rehab, really still struggled vestibularly. Her head moving through space made her super nauseous, kind of typical concussion symptoms. And then we dealt with that. And then through doing some of these higher level sporting activities to get her back, I was like, whoa, you're a high level athlete, but when I throw the ball too high and you have to track it up, you fall over. That shouldn't be happening. Or you're getting all of these fouls in hockey because when you look up, your arm lifts and you're lifting your stick off the ground and you're getting put in the penalty box for that. But that's not a conscious choice for you. And this kiddo, mainstreamed in school academically, struggles, but mainstreamed in all of these high level sports because it's very sensory seeking. So parents were like, she wants to move her body. She needs big movements. Let's put her in sports. Absolutely the right thing to do. But she's managed to compensate for all of these. I have never had such a high level athlete test positive for every single reflex, every single one. And as we break them down now, it is becoming so obvious, but we never saw it because she was so good at compensating and not showing it. And then really beating herself up. I don't know why I keep fouling in hockey. I'm not trying to lift my stick. No, you're not trying to lift your stick at all. It's just when you lift your head up in the opposite direction, your arm lifts. It's your Moro kicking in. How can we, do that? Or if she has any sort of fall in sports, it's immediate tears, upset, regardless of if she's hurt or not. That's been really hard for the parents to understand. Why is she causing such a big deal? Her fight or flight kicks in when she falls. So it doesn't matter how big the fall is. She's going into that fight or flight every single time. So yes, that's hard for a parent to be like, well, she's crying wolf all the time. No, she's not. She's reacting differently to this. And actually, I should be more worried over the fact that she doesn't react to pain as much as she should. Instead, she reacts to the fight or flight of the situation. And then will often go for flight, even if she's in pain and run away from it. So there's so many pieces, but if this child hadn't had a concussion, hadn't come to see us where we specialize in really complex kids at the clinic I'm at in the city, she would have been thrown back into sports and would have so many mental health issues ongoing, thinking that she's not a good athlete because she struggles with the higher level skills that her teammates pick up on fast, thinking that her coach is viewing her as not someone that listens because why can't she stop fouling? All of these pieces. And now parents have jumped on board and are like, oh my gosh, everything is making sense. But it took us going all the way back. We had to manage the concussion. We had to manage all of these pieces to then get down to the root of why are you so dysregulated? Why are you so athletically capable and yet trip over your own feet? Why is all of this happening? And it really was the case of when she's in sport mode, she is so on, she's in that high performance level, and she's working so hard to mask everything else. But when she's just walking through space and feels very comfortable, she's a lot less aware. The reflexes kick in, right? So a child crosses her path quickly, Moro kicks in, she's on the floor. Nothing tripped her. What happened there? You're a high level athlete. Why are you falling? But it's because you weren't expecting that. In soccer, you're expecting a ball to come towards you. You've trained yourself to not have a Moro reflex to that soccer ball coming at you. However, that child walking through your path was very unexpected. Moro, and you're on the floor. So it's been really interesting just like breaking down all of these pieces and really dialing it back to be like, what is the foundational level here? What are we working with? But then on the flip side, I've got a 16-year-old client who has cerebral palsy. Most of her reflexes are still retained, but she's learned to use them functionally. So when she goes to climb the stairs with support, she turns her head the opposite direction of the leg she's trying to lift because it causes flexion of that leg. Nobody's ever taught her to do that. She's just figured out the way her body moves through space. I would be doing a disservice to her integrating her reflexes now because that's the only motor pattern she knows to reliably use, and she needs it. As long as it's not causing massive things like if you have an ATR that's super strong one way and really weak the other, your risk of scoliosis is high if you're always going to one side. Your risk of hip dysplasia is higher if there's that asymmetry. If you're doing them symmetrically and functionally, I'm leaving them alone for that girly. There's other things we can be working on. They're not causing her dysregulation. They're actually allowing her to use her complex body more functionally. I'm not going to touch those. But for our other kiddos, that's not the case. They need to work to get them integrated. So it's been like, even over the past kind of 6 months for me, jumping on this reflex bandwagon, being like, integrate it all. And then I see them being used functionally by my complex kiddos. And I'm like, hang on, no, we're not integrating them all. We need to be really careful and very specific with what we're approaching for these kiddos and how we can use these reflexes to potentially benefit them and give them more motor pattern than they would independent of that. Because generally reflexes will beat out their spasticity, but conscious motor patterns won't. So if I've got a kiddo that is really tight and I'm struggling to bend her knee, I can ask her to turn her head and I can get that knee no problem. Versus when I was fighting it, I couldn't because she's using so much consciousness and the brain and the spasticity is all linked. So even though she's maybe trying to help me to turn off that leg and get it into flexion, just her thinking about that leg is going to cause activation. Right? So I'm oftentimes, kind of distracting my really tight kids so that I can get that flexion. But if I can teach her, hey, you can help me bend that knee. If you turn your head to the right, I can get your left leg bent. That's functional for her now. That's giving her more autonomy with her body. So it's not even black and white in the sense of like, we need them gone. We'd like to see them gone in our typical bodies, in our traditional, typically developing kiddos, even in our neurodiverse kiddos, where they don't need those reflexes for motor patterns, where their body can move through space and the ways that, they're not fighting gravity, they're not fighting spasticity, they have the ability for full range of motion. We do need to get rid of those reflexes. But I also need to look at it through a slightly different lens for my more complex friends, where if I eliminate that, did I just take away your ability to roll? Did I just take away your ability to reach for something that you see and want? Did I just take away your ability to lift up your foot to climb a stair? Just because I wanted to integrate it. So forever balancing that. And, it's never easy. And this is why, I love having colleagues who know about these reflexes where I can bounce these ideas off of. Because if it was just me in this world trying to make all these decisions, it's really tricky. But, the parents buy in really fast to it. And I can explain to the complex kiddos parents, like, hey, you're probably reading about reflexes now. It's, the new thing that's being talked about in therapy. She's got them, but we're leaving them. Please don't let any other therapist make big changes here without chatting to me about my reasoning behind this. Because there will be therapists who will, do the course and be like, oh my gosh, my kids with CP all have these reflexes. Let's just put them through these motor patterns and get rid of them. But that's not necessarily the right approach to them either. But yeah, reflexes are so weird and wonderful.
Yeah, it's pretty neat. Once you really get to know an area, you start seeing things that nothing is black and white. Everything is in that gray. So you're at that point, aren't you? Like seeing that, and it's a cool place to be, but it does make it more complicated.
Makes it so much more complicated. We're like, even at the well body group where I'm seeing, these typically developing kiddos and these typical bodies, and seeing, this kiddo who will like then, the parent will be like, oh, I'm going to refer you their friend. They're struggling with a lot of the same things. That child's reflex profile ends up generally being quite different from the other kiddo. Where yes, at the forefront, the regulation was the issue, but maybe that child is not struggling at all with the ball skills or the writing skills or the feeding skills versus this other child that's actually struggling with, all of these pieces, but the emotional regulation is at the forefront for both. So even then I'm just like, it's never as easy as sending the same reflex program again and again because I'm having to specialize it so much for every kiddo and every family. And it's, not just, yep, they have a motor reflex, they need to be doing this, this, and this. It's like, well, can the kiddo even get into that motor pattern? Because the exercises that help to integrate the reflexes challenge the reflexes. So can they even break through that reflex enough to even get into that motor pattern? Or do I need to be the one working on that with them hands-on to facilitate that motor pattern? Because sending them home with this, mom's not going to be able to see it, or mom doesn't visually see what I'm seeing to be able to then correct for it verbally or physically, things like that. So it's never as cut and dry of like, do your exercises for a week. It'll be great. Sometimes, my kiddos will go home and do their bum scooting for their spinal glenoid reflex. And I've got a kiddo dry as of the third day. And then I've got another kiddo where it took 3 weeks of that program to stop wetting the bed overnight. And another kiddo where if they don't do that bum scooting during the day, they're going to wet the bed at night. So it's, it's not as cut and dry as it has, initially seems, and really changes. And I often get parents being like, how long do we need to work on these for? I don't know. I don't have the answer to that. But if the tools are working, great. So we start, high dose. I say it's a marathon, not a sprint. We need to be doing these motor patterns daily if possible. Then once we start to see changes, we can start to look at tapering off, but knowing that we're not going to go cold turkey. That reflex, is not going to do a light switch from I'm here to I'm not. It's slowly going to integrate, and we're going to continue needing to stress the system and challenging that reflex to keep it at bay. So there will be some kids, I've got ones where we've been working on reflexes for years. Again, more complex bodies generally, but the parents are like, when can I stop this? And I'm like, as long as we are consistently seeing progress, we're going to continue. I'm not ever going to ask somebody to keep going at something that's not working. I'm not going to say like, all right, we've been doing this for 2 years. I've seen no changes. Let's do another 2 years. That's not going to be happening. But again, it's that marathon, not a sprint. We're going to plug away at this, see what we can titrate down. Maybe it's a case of a lot of my, nighttime bedwetters need almost positive input on their back to desensitize it before bed. So I've got a lot of parents rolling a ball on their back with a lot of kind of pressure going into it so that it's that deep pressure, which is really regulating versus that tickle pressure that causes that stimuli for them. Sometimes just that desensitizing makes a difference where I've got kiddos off the bum scooting protocol, but if they don't do the ball on their back as part of their routine, they're almost guaranteed to wet the bed that night. So again, it's that handoff, but the parents will always choose a ball on their back over that child wearing pull-ups, right? And, I can teach that kiddo to eventually stand against a wall with the ball between their back and the wall and doing that input themselves. I'm likely giving it to the parent as part of like a calm down regulation thing before bed as well. But that kiddo can absolutely have the autonomy to do that input themselves eventually. So they're not always relying on the parent to do it. So there's never, I'm never giving a program being like, that's it. You're going to be doing that for 10 years. Check in then. But equally, I'm never going to guarantee like, hey, a month of this and we'll be good to go. I don't know. It's going to come down to what's the consistency, How fast is that kiddo reacting to it? How much else does that child have going on? If there's a ton of psychological components in there and then we're working on the moral reflex, we might not see that moral reflex integrate very fast if there's all this other things happening, right? If there's trauma at school, if there's bullying at school, all these other pieces, I'm not going to quickly break through that reflex. And again, that's where OT and psych and all these pieces, collaboration is huge too, because I may not even be able to get to that reflex. That child may not even allow me to put them into that position that could elicit a moro because they're so hyper aware. Then I need to break down, some of the psychological components of that. I need to build trust with that child and all of these pieces. So it's never as simple as like, do the sensory project course, look at all the reflexes, do some tests, write a home program, see you later. It's very, it's ongoing all the time. So it's been really interesting. And in terms of kind of reflex integration for any parents that are like, looking at their little bubs at home right now, being like, oh, yeah, like I see when their head turns, I'm seeing that STNR. Yep, when I put my hand in their palm, they're holding it onto it. When do we want these to disappear? By the first year of life, they should all have been replaced by conscious motor patterns. And, some will start to disappear quite early. So the rooting reflex disappears really quite early within that first 3 months. Once that child's vision has developed enough that they can find a food source visually, they're going to switch over to that. And, the palmar grasp, that tends to disappear around that 3 to 6 month mark. All of a sudden, your baby's not holding your hand anymore, and they would never wanted to begin with. It was a reflex. So all of these pieces, but generally by the end of a year, when kiddos, in theory, should be starting to get on their feet and walk, we should see all of these have been integrated. And if at that time we don't, that's when we start looking, do they have a lot of the risk factors for primitive reflexes? What was their birth history like? What was their kind of milestone like in their infancy? Do they have a tongue tie, lip tie, etc.? And then starting to look through those. Were they a container baby? Were they never put in tummy time because their reflux was so bad that every time they were put on their stomach, they threw up? The amount of times I hear that, and I get it. You're not wanting to put your baby on their stomach to scream, cry, and vomit. I totally get it. But now that child skipped crawling because they never learned how to do anti-gravity movements from being on their stomach. Yes, maybe they're walking on their feet now, but what happens when that kid walks up to a ladder at the playground? Do they know how to coordinate their upper limbs and lower limbs to climb a ladder? Maybe not, because they never had to coordinate the left and right sides in crawling. They're going to struggle at a rock wall, right? All of these things that are just really innate playground activities, we need these pieces for. And if we're not getting these foundational pieces in infancy, either because we're in containers or because we've had a traumatic birth and X, Y, Z, and all of our reflexes are retained, we're going to start seeing them in function. And those are some of the kiddos that are going to struggle socially because they're not keeping up with their peers, or who are going to get really frustrated because why can't I climb the ladder like everyone else? Did everyone go to ladder climbing class? What did I miss? Type thing. But again, it's that brain-body connection. It's just not as fortified for them. And that's frustrating. That kid is going to then have some psychological struggles, right? From the get-go, we're comparing ourselves to our peers. Well, why do they run really fast? Why can they sit with their legs crossed and I can only W sit without getting fatigued? All of these pieces, we're forever comparing. Parents are always comparing as well, right? Mm-hmm. So, the more that we can just be like, okay, let's break this down foundationally. And that's not saying like, if you put your kid in a container, look what you've done to them. No. Parents do the best with what they have. When we know better, we do better. And again, none of these things are permanent. We can work to fix them. But I would say to any expecting moms out there, clear your baby registry of anything container-wise. If you need one, you will go out and buy one because you feel like you need one. Until then, you've got a floor, you've got a crib, you've got your body. That's all that they need. Yes, if you have 17 other children running around at home, you need to put them up on something to keep them safe. We always have to balance that. If you're really struggling with postpartum depression and you need a safe spot for your child that you know that they're contained and giving them some movement, get a swing. That's fine. But we're not putting them in it for 8 hours a day. That's not going to be their primary spot. So I'm never going to say like, get rid of all of the things, but if you can start out with very little, then you'll buy only what you need instead of Oh, well, I have a swing there that we paid all that money for and we're not using it. I got to put my kid in it every day to feel, girl math, make it make sense. But no, just buy what you end up needing. And if it's a Jolly Jumper, I promise you didn't need it. If it's an extra saucer, I promise you didn't need it. But a swing, okay. Just don't keep them in it for ages. A car seat is not a spot for your kid to nap, unfortunately. If they fall asleep in the car, absolutely. But once we transition them out of that car, they need to be napping on the floor in their crib, not in a spot that's contained, because they're going to get a flat head. They're going to get a tight neck. Then we're dealing with torticollis. Then we're dealing with plagiocephaly. Now we've got a head that's really hard to fit a hockey helmet on it because it's flat at the back. And now you're spending $200 extra getting a custom hockey helmet because you're kidnapped in the car seat a lot. Right. And these little things where they're like, I don't care what my kid's head looks like, it's whatever. But I'm like, financially, you will when your kid wants to do sports and their head doesn't fit into the typical things, or your child needs glasses, but always had a preference of laying on one side in the car because visually that's where the window was. So they were always turned towards the window. Now that ear is sitting a centimeter lower than the other. Good luck finding glasses that fit that kid's head. Right. So it's all of these pieces that just like play such a role. And I know at the foundation, it's like, well, I don't care about my kid's cosmetics. Like, if the kid's head's a bit lumpy, that's what hair's for. I'm with you. But why is that kid's back of its head flat? Why is one part of the head flatter than the other? Are we putting them in these containers and in these positions where they're not rolling out of them? Like babies never keep their head still. We should be going like this. That's why babies typically have a beautifully round head. They're literally grinding it down on the floor themselves. But if we've got a kiddo that just is there and sits there because this is the car seat or this is the swing position, and visually all the stuff's always to their left side, we're going to have some more issues with that as well. And then we're going to have retained reflexes because that kiddo's not moving their head through space. We're going to have vestibular issues because that kiddo's not flipping their head from side to side, and those crystals in their inner ear aren't moving the way that they should. So it all ties into all of the things, and I could talk on for ages about everything,
Yeah, it's all
but
connected, isn't it?
it's all connected. It really is all connected.
Well, thank you so much for coming on and giving so much information about the primitive reflexes, about why they're there, how we can integrate them, and just so much hope as well. It's for parents who realize that they think that their kids probably have some of these that still are retained. So thank you so much for the work that you do and for your time here. I really appreciate it.
Oh, my absolute pleasure. And if we need to do a sequel to this and get even thicker and deeper into this, I would love to, because just the more that I can share, and I love that this podcast is making it so accessible for parents to be able to get this information and just to start considering these things without, necessarily having to jump on and book an appointment with someone or, reach out to a specialist in their area or even try and find one. Like this is a great place to start. Are any of the things that I said today kind of resonating with you and your child? If so, maybe this is something worth looking into. But I'm so thrilled that you've got this, so kind of mainstreamed and available for new mamas who are going into this world of Google where there's everything out there and you don't even know where to start. And you've got a healthcare system that's very hesitant to spend money on kids and loves a good wait and see approach and will quickly, intervene with delivery and birth and all of these things and not fully share, what could be some of the implications there to a traumatic delivery. If we use forceps and we didn't really need to because we're just trying to expedite the delivery, that's now actually a traumatic birth for that baby. Now that baby didn't use their reflexes to exit the birth canal. Now we've got potentially some things that we need to keep our eye out for. So it all really, comes all the way back to these things, from the very beginning of their life, their entrance into this world, or even that mom's pregnancy. Another big one that I didn't even mention was hyperemeresis, prolonged morning sickness, if not day-long sickness. That puts the mother's body into such a state of stress that then we often see a moro reflex in those kiddos because they're subject to that fight or flight from the get-go because that mom is in that state of stress every day, violently ill. So it's all of these risk factors. And it's, I don't want parents to take away from this that like, oh my gosh, I've done all of these things to make a mess of my child. No, you had no control over your morning sickness. You really had no control over your birth delivery and any of those things. It's what we can make, ourselves have control of after the fact. You can have control over what your child is laying on and what they're placed in during the bulk of their day. You have control over, starting to look at things not just from a behavioral point of view, but potentially from a sensory point of view. And I think just the more that we open up these lenses and the more that we gain awareness, like I said, when we know better, we do better. So, I hope from this podcast, the takeaway is like, these are some really interesting strategies that I can implement at home to support my child, or these are some things that I could look at and maybe need to look into more. Or, my friend is, struggling with some of these things and is talking to me about it and feels like a bad mom because her kiddo's not eating anything but chips. This can be really validating for her to listen to and be like, it's not me. My mom saying, or, the grandma of that child saying, like, well, they'll eat eventually. No, not necessarily. So you're not wrong for feeding your child the only thing that they're willing to eat, because at the end of the day, your child needs to eat. But let's unpack that. So I don't want this podcast to be like, look at all the things that moms and dads are doing wrong. It's look at all the things that we could be doing to support our kiddos' needs. Look at some of the things that we should be looking out for. And when in doubt, get assessed. Because again, if it's a one-off thing and it was a waste of 1 hour of your time, I'm fine with that. I would rather that than your kiddo really struggling educationally, socially, psychologically because of all of these things and masking them and just getting by until they can't. And then we're dealing with a whole other ballgame of the until we can't. And that's when we see autistic burnout. That's when we see, even burnout in, individuals with ADHD and various things where like they've worked so hard to mask and to get by despite sensory, despite reflexes, despite all these things. You can only do that for so long. And we don't need 6-year-olds getting burnt out. It's not, we're all getting burnt out already as adults. We don't need our kiddos getting burnt out just because they're in a body whose nervous system is not set up to support them.
Yeah, absolutely.